from the station that's on your side. Awarded the National Edward R. Murrow Award for Newscast Excellence. This is Channel 7 News Daybreak.
The time now is 6:24. As you age, you may have noticed that you tend to bruise more easily. Why is that? And can anything be done to make a bruise go away faster? Well, joining us this morning with answers to those questions is Baptist Health's Dr. Devon Ballard with Sherwood Family Medical Center. Thanks so much for being here, as always. Yep. And we want to start with what exactly is a bruise. What's happening to our bodies when we bruise?
So underneath the skin, you have these very small capillaries that are protected by a fat layer, and the capillaries get damaged, and when they damage, they actually bleed, but your body's own mechanism helps stop the bleeding eventually, which causes whatever bleeds out turns into a bruise or a discoloration of the skin.
Is there any way to prevent a bruise? I mean, obviously, other than falling or getting hit, but any way to keep it from bruising badly?
Well, the bruise prevention is to try to keep from falling. Like some older people, you got to look at their houses, and do they have cords or rugs or somewhere that shouldn't be there. Another thing, a cause of bruising to talk to your doctor about sometime is some medicines people are taking prescription-wise or over-the-counter. Some people take over-the-counter medicines for headaches, like BC powder has aspirin in it. Aspirin's more prone to bruise because it makes you bleed more. So letting somebody know what you're taking helps with the causality of bruising. But when a bruise happens from whatever cause, then sometimes just put ice, not directly on the bruise itself, because put inside a cloth or a bag, and then put it over it to help, because ice helps decrease the amount of blood flow to the area while your body's stopping the bleeding, so less blood flow is less bruising. Okay, and then if you have a bruise, is there ever a reason that you should go to a doctor? Yeah, if you get bruises just from somebody touching your arm, or just why did I get a bruise, why am I bruising? There are some causes of bruising that we need to investigate. You got to check a blood count. Some people's platelets can be low. So there are some blood tests that can be done to investigate. There are some bleeding disorders people don't know they have. And so there's some things we can test for lab-wise to make sure we're not having a causality there. However, some people just bruise easier because as we get older, the skin gets thinner and the fat layer in the skin gets thinner, so you have less protection, and also sun damage. You see people that are in the sun most of their lives, if they're an older person that worked out in the farm or outside all their lives, and they have a lot of sun damage to the skin, it's easier to bruise, and you'll see them bruise a little easier too. Typically, how long is a bruise going to last? What should we expect? 7 to 10 days, and it's the classic. It'll be, the first day it's really purple, and then, you can tell if it's 4 or 5 days later because it's kind of yellow to greenish, and then it just goes away. But some of the bigger bruises, it's actually called a hematoma. When you get a big bruise and a lot of blood, a hematoma would be a raised area. That can take a couple months to go away. Which is normal, though. Correct. That can be normal. Okay, good information as always from Dr. Devon Ballard. Thanks so much for being here. If you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST.